Welcome to another edition of Calm in the Chair, a dental fear solution. I'm your host, Dr. Vincent Monticciolo, and today we're going to be talking about gaggers, why it's so difficult for gaggers to have traditional dental treatment done, and what are the options. We're going to talk about the different types of gaggers, two different types, the advantages of using dental sedation for gaggers, and I'll give you a few examples of patients that we treat to get them through the gagging process. So let's get into it. Patients with a strong gag reflex often find it very challenging to undergo dental treatment due to the physical, psychological discomfort associated with this condition. Most people don't realize because patients look normal. However, a gag reflex or response is very difficult to get through dental treatment. So a lot of people have an overactive or hypersensitive gag reflex or response, usually due to trigger areas. So a gag reflex would be if they're taking impressions and materials in the back of their throat, touching the tongue, the soft palate. Some patients just trying to take an x-ray that's going to gag them. So they have this anxiety, fear, or anticipation of what's coming because they've been through it before. A lot of patients, myself, I don't have a severe gag reflex. However, when I was a child and taking impressions for ortho models, that was enough to scare me from impressions and give me that impression that I thought I was going to vomit there. And, you kind of have that anxiety every time they come at you with that. This fear of the gag reflex or response heightens their sensitivity, which triggers it even more. So a lot of patients have sensitivity to, like I mentioned, the x-rays, trying to take x-rays, trying to take impressions, sometimes having a dental instrument touch their tongue, the water in their mouth, the hands in their mouth. Some patients just can't handle that, or even the thought of it. Some patients, just being in the dental office and the smell is going to get them nauseous to think about and give them that gag response. So some patients have a difficulty in opening their mouth, and when we try to get in there, they have a reflexive closing of their mouth or a gag reflex coming forward. So what happens with these patients is, knowing this, they will delay their treatment or interrupt their treatment for long periods of time. So a lot of them have this embarrassment or fear of judgment. They don't want to gag or delay treatment or vomit in the dental office. So a lot of times these patients will just delay that treatment. So what they call avoidance behavior. The problem with that is obviously their oral health is going to diminish, and we're going to see more breakdown, more problems with their oral care. A lot of people have this physical or psychological fatigue where the prolonged stress of trying to get through a dental appointment, even a cleaning, they have this negative association with being in the dental office because they have so many interruptions. They'll get started and then they're like, and I got to stop, or, they're gagging because of the water. So they can't really get through, even some patients, even a cleaning, but definitely not taking the x-rays. Even the new x-rays that we have, which are digital, make it very difficult on people with a heavy gag reflex or response. So I keep saying reflex and response. What's the difference? Well, a gag reflex is a natural involuntary reaction of the body to prevent a harmful substance or protection of the throat or the oral cavity. So it is a protective mechanism. Characteristics is it's involuntary and it's automatic. It's reflexive. Okay, so it can vary in sensitivity. Some people have very high gag reflex. Some people are hypersensitive to this, and they're going to react that way. The people do not have control over this, whereas gag response is different. Gag response is more of a broader term, and it includes the reflexive gagging, but it also includes physical stimulation or an automatic response due to psychological factors, the fear, the anxiety, the memory of what they've had in the past. So we see a lot of gag response where I can just touch their lips and they're already into a gag. They're already telling me, Doc, I can't do this unless I'm sedated. They know better. And usually it's not the reflex. This is reflexive or voluntary to an extent, where it's a reaction of their fears or their anxiety. So they're automatically going to go into this response anytime we get near them, try to put suction, try to put impression, try to put dental instruments in their mouth. This is mostly, these patients are only manageable really with dental sedation. Without it, you're not going to get near their mouth. These patients also delay treatment, which gets to be a problem. Okay, so their oral cavity breaks down, they get periodontal disease, they get bone loss, and they think, oh, I'll just get dentures in the future, which is what they come in for. And they say, yeah, I'm ready for dentures. I'm like, you're never going to get a denture in your mouth. I can't even get past your lips. Try putting a denture on their palate, the back of their throat. They come forward. It's just unfortunately never going to happen. So if they have enough bone, yes, they can sometimes get implants. But that involves, obviously we have to sedate them, do the dental treatment, take the impressions. It involves multiple appointments. So, obviously those patients hopefully can think ahead when we can still maintain their mouths and get them into better health. So how does dental sedation solve this issue? Well, it suppresses the gag reflex or response. So obviously we do IV dental sedation. These patients have no memory of the appointment. So once, usually when we see them, we're not always even able to get in their mouth to do a diagnosis. We sometimes have to sedate them, obviously, to get the x-rays and then to do a cleaning and then do their diagnosis. Sometimes we have to bring back for another appointment to do their dental treatment because we're not able to diagnose it ahead of time. But doing the sedation has just many advantages. Obviously, like I mentioned, it suppresses the gag response and the gag reflex. It also enhances the patient comfort. So they know that they're coming in for a dream visit. They're not going to remember anything. They're not going to have any response. They're not going to be embarrassed. It's going to be very calm for them. And once we sedate them there is no anxiety. They're looking forward to it, to getting caught up and getting this dental treatment done because they know it's going to be under sedation. This increases the efficiency for everything, for us, for the dental treatment, for us moving forward, for us getting through their treatment. There is no interruptions because they're just going to be snoozing through that appointment, which really increases everything, increases the efficiency of everything that we're doing. Like I mentioned earlier, it reduces the anxiety of fear in the patients. They are not hyperventilating. They're not sweating when they come into the operatory. They know that they're going to be sedated. They're not going to have that embarrassment or fear of possible vomiting. And it allows us to get through the complex or even lengthy procedures with no complications. So for the dentist, it's a great option. For the patient, it's an even better or only option if they have a very hypersensitive gag response or gag reflex. So the patient cooperation is just so much better. We're allowed to do, all the dental treatment that is necessary. So this obviously builds their confidence and encourages them to maintain their regular routine care. We're able to see them on a regular basis, sedating them. Unfortunately, sometimes we have to sedate them just to do their cleanings, but to maintain that. But once we get them to an ideal health, then it's just maintenance, which makes it a whole lot less expensive and a whole lot easier on the patient. It's also because they're sedated. It's a pain-free, fear-free procedure. They're not going to have any recollection of the appointment. So this is a great option for gag response, gag reflex patients. So they're able to get these impressions done without any of the complications that we normally have. What other patients have this? Obviously the special needs and the dementia patients. We're not able to put something in their mouth because they're going to have an automatic response or reflex or try to push it away without being sedated. So giving you some examples of some of the patients that we see on a daily basis. Obviously patients delay their treatment if they've had bad past experiences to the point where they're either in pain, so we can sedate them to do the root canals, do the extractions, remove their wisdom teeth, whatever it may be, without any of that gagging coming up. We can also, if they've let it gone too long, we can, put them into snap-on dentures if we're able to use implants. So then there'll be nothing on their palate. We can do permanent teeth with the implants. Obviously, this takes longer, involves more appointments. So for those that have a really hypersensitive gag response or reflex, we have to sedate them for almost every appointment leading up to this, and then to seat their dental treatment. So is it ideal? Not always, to have to sedate for numerous appointments, but it is feasible, and that's what we do for numerous patients. We see this every day on a regular basis with patients not being able to be seen in a normal dental office. It's not that the dentist can't do the dentistry. The patients just won't allow it. So it becomes a stressful situation for both the patient and the dentist. The dentist isn't able to finish the treatment or do a good job, because the patient is having to stop so much, having to gag, having to suction. It just makes it very inefficient for the patient and for the dentist. These patients are referred over to us. We're able to sedate them, and it's a happy appointment for everybody involved. So we're gonna leave it with that. Gagging is, really, a lot of patients have had this response. Some people can't take pills because they have a heavy gag reflex or response. But dentistry is one of those things, unfortunately, where we're in the mouth, and we are going to trigger some of those touchy zones that cause a patient to gag or have that response. So if you have any more questions or concerns, obviously you can reach us at 813-DENTIST or online at happydentistry.com. I do just want to take a quick second to send out happy holidays, obviously, to all our patients and sedation patients out there, and all our staff and team members, and to wish everybody well going into the new year. So until next time, keep smiling.